All right, hello everyone. My name is Brittany Chester. I'm a doctoral student in the nutrition department. I am also a registered dietitian and certified diabetes educator. So I spent many days educating patients who were admitted to the hospital or ER for complications of diabetes. So after a long day, many times, I've sat there and dreamt about a diabetes utopia, okay? So it's this perfect world, okay? Not a perfect world where my patients can eat as many brownies as they like and their blood sugars remain normal, but a world where everybody can get the diabetes education and care that they need and deserve. So I know there's a lot of barriers to this. I won't even get into finances and insurance coverage because I've only got 2 minutes and 24 seconds left. But I wanted to know what I could do starting with my own profession, because a lot of people are diagnosed with diabetes and sent home with a prescription, fear, and a lot of confusion. So I wanted to start with what could I do, like I said, with my own profession. Our research evaluates the efficacy of having a registered dietitian in the office with a family physician. So some things that we're taught as dietitians are diabetes self-management education and support. We can provide this to our patients. So a few of those things include helping them to maintain the pleasure of eating, right? That's important, by still helping them to maintain their blood sugars and their weight. It helps to teach them about daily, day-to-day planning in order to make these things possible. So we tested the hemoglobin A1C test before and 3 months after we did the session with the dietitian. Now, what is the hemoglobin A1C test? I like to call it the blood glucose secret revealer, okay? Because the hemoglobin A1C test tells us your blood sugar for the past 3 months. So you know that late night snacking of chips and sweet tea while you're watching The Bachelor or your favorite sports channel? Yeah, that shows up in the hemoglobin A1C. So the American Diabetes Association tells us that anything less than 7 for someone with diabetes means they're in good control. So our patients, it was 40 patients, their average A1C started out as a 7.1. We tested again after 3 months later, having that one session with the dietitian, came down to a 6.8. So as you see, it went from the monitor closely area to the in good control. So my hopes are with studies like this and more, we can learn to create this standard for how we should start to educate people with diabetes. So hopefully one day, my diabetes utopia can come true. Thank you.